Hello,
Mhm,
viewers. Welcome to Ezra Wellness, where you learn proven ways to healthy living. Today, I'm
mhm,
very excited because I have with me an optometrist. Because
mhm.
at Ezra Wellness, we talk about everything, but we haven't talked about vision yet. But this year, we'll bring a lot of people, and this is one area that I want us to take a look at. Because most people have a lot of eye issues, they don't even know it. So that is what we are going to dig in today. I have with me Dr. Afua Antwi. And Dr. Antwi is an optometrist who has been working for the past 10 years in Connecticut. So she's really versed in this area of the vision that we're going to be talking about today. Dr. Rekwan graduated from the New England Optometry School. That is a college in New England here. And she is married to her lovely husband, Dr. Nate, and they are blessed with two lovely children. And Dr. Rakwa is, she's a believer too. She serves on her church board. And while she's free, she makes time to have arts and crafts. We have to release some stress, so she did that. Dr. Rakwa, welcome to Ezra Wellness.
Thank you so much for having me.
Good, good, good. I'm excited this morning. This morning, I really want us to talk about eye health. But when we come to the eye health, because this is not my area so much, I don't have really like this pinpoint things that I want to say. But from your practice, I just want to ask you, what is the most common eye issue that you see among people that we could talk about today?
Okay, so mostly the main thing that brings people in is I can't see. And I can't see can be a number or a big umbrella of so many different things. It could be as simple as you need glasses, whether to see far away or you need glasses to read. It could be as complicated as an underlying disease. There's glaucoma, there's diabetes, there's macular degeneration, even cancer, brain tumor. There are so many things that manifest in the eyes, but mostly the trigger that brings people in to see me is always I can't see. And so then when you come through our examination, that's when we are able to figure out what the cause of the issue is. I would say in uh, my area or where I practice, main issues or the majority is just, people needing help correcting their vision. When it comes to the health aspect, there is diabetes that leads to diabetic retinopathy that brings people in. Hypertension that also leads to hypertensive retinopathy. There's glaucoma. There's macular degeneration. Those are the big, more common causes of issues with the vision that would cause someone to come in. If you look at the population dynamics will kind of determine how much of one condition is more prevalent than the other. And so, depending on the type of community you serve, if you serve more Hispanic or African American or people of African descent, you tend to see more glaucoma, you tend to see more diabetic retinopathy because of our diet. You tend to see more hypertensive retinopathy because of diet. More Caucasian communities, you tend to see more macular degeneration, but also diabetes, hypertension. But the prevalence is much higher in the African American, and Hispanic communities, just because, with all the flavorful foods that we eat, that tends to do us in.
Oh boy, oh boy. Well, Dr. Rakwadi, this is a lot of areas, and I think we will zero in on the diabetic one for today, so that
Exactly,
going forward,
exactly. Mm-hmm.
definitely we will come back again and talk about glaucoma. I think that's also a big one out there. So, but today
Exactly. Yeah.
let's
Mm-hmm.
focus on one because it's big. So,
Yeah.
what is the main cause with a diabetic
Mm-hmm.
one? How will somebody know that these signs
Mm-hmm.
are symptoms that I have? Because I know diabetes, they say pre-diabetes, full-blown
Mm-hmm.
diabetes. It's kind of little gray area. You want to go into that a little bit?
Mm-hmm.
Mm-hmm.
Okay, so when it comes to diabetes and how it affects the eyes, there is diabetic retinopathy, but then there's always also changes to the eyesight as a result of the spike in sugars. And I've had a few instances where I have diagnosed diabetes in my chair, even without confirming it with the blood work, doing the A1C and all of that, just because of how diabetes presents in the eye. And so, an example, you're walking around, your sugars are 120, and then, you spike 200, 250. If you sustain that for a few days, what happens? It starts to change your vision. And so someone would come in and it's like, my glasses no longer work. You go to check and there's been a shift, a very big shift, and it's very characteristic of diabetes. We call it a hyperopic shift. And when that happens, you know right away. And so what we do is then we send them to their primary care. Either if they haven't been diagnosed diabetes, then we say, okay, dear PCP, this is what I'm seeing in my patient. And so I'd like for you to run these tests. And most often, usually 95% of the time, it comes back diabetes. Or a diabetic patient who isn't controlled properly. And so there's that fluctuation in the sugars. That also, I've had one time, a patient of mine came in, was at the emergency, ended up in the ICU because his blood sugars were 1,000. And so, yes.
Wait a minute, and they have come for an eye checkup. Wow.
So he came in, it's like, I can't see anything. And so we went in, we dug in, and that's when we realized. And so, and even that is just the refractive, like a change in your prescription of the glasses, the number of prescription. And then when we come into how it affects the structure of your eye, that's when we go into diabetic retinopathy. And that's why we go into diabetic cataracts, because all of that, the spike in the blood, and all of this is because of the spike in the blood sugar levels. It directly affects the structure of the eye. And that is what leads to all of these changes and all of these effects on the eye that we'll be discussing further today. Yeah.
Wow. So that means, viewers, if you're listening to us and your glasses looks like you cannot see properly, even though you have not been diagnosed with diabetes, please get a check. Or those of us who don't have glasses, you think, oh, I'm growing old. Please check it out. Wow.
That's that is for sure.
Wow. So Dr. Rekwa, then what I would say is that if someone come in with these conditions, normally I know as an eye doctor, you're looking at the eye, maybe glasses. What else do you use to manage these conditions, like when they come in?
So when they come in, and that's why people who've been diagnosed with diabetes, we always collaborate with either the endocrinologist or the primary care provider, because with the eye is special in that it's the only portion of the body where you can actually see your blood vessels. So you are able to visualize and know exactly how the blood vessels are looking. And that's why when you're diagnosed with diabetes, your primary care doctor will say, get your eyes checked. And there are some doctors that will enforce it, where they will force you to go get your eyes checked. And if you don't go, they'll keep pushing, just because it gives the treating doctor an idea of how the treatment is working. So when a patient comes in, we check the vision, but that's not all we do. We look at the eye health. We look at the front, the middle, to the back, because all of that gives us insight as to what is going on. And so let's say, there's a refractive shift, like we discussed. There's been a big change in your prescription because of the sugar. We manage it, usually collaborate with the primary care. Once the sugar comes down, so we'll be doing all these follow-ups until we get the patient back to their previous prescription. If it's a diabetic cataract, same thing. We manage until there is the need for the cataracts to be removed. If it's a diabetic retinopathy, depending on the severity, because diabetic retinopathy is graded from mild, moderate, severe, non-proliferative to proliferative diabetic retinopathy, which is the more severe one. And so describing what diabetic retinopathy is you come in, we look inside your eyes, we are seeing your blood vessels, we are seeing bleeding spots. And so there are pockets of blood that just leak from your blood vessels. If it becomes more moderate, we see a whole lot more. If it becomes more severe, you come in and it's just blood everywhere. And that is leaking of fluids over and over and over. It gets to a point where, because the blood vessels carrying the blood to an endpoint, because we need the blood to feed our tissues, same thing to feed our cells in the eye. So if the blood is not getting to the endpoint, what starts to happen? The cells start to die off. And so that triggers your eye to start to produce new blood vessels. And you'd think that's a good thing. That's a very bad thing, because it grows in such a haste that it's not formed, because it takes a lot for us, a whole 9 months for us to be developed, fully grown, fully functional. So suffocating or dying out tissue triggers what we call VEGF, which is these hormones that causes new blood vessels to grow. It grows very rapidly, so it's not formed properly. And so when we see this new growth of blood vessels, that's what we call proliferative diabetic retinopathy. And so when that happens, that is when now more treatment is needed, I should say, not from your primary care, which they also continue to do, but now you need laser and you need injections, because you need to stop the growth of all those blood vessels. Because what happens, I have seen someone who was lost to follow-up for many years had these blood vessels growing everywhere, and it had grabbed on to one of the tissues so tightly, it pulled the whole retina, pretty much detached the whole retina, ended up being blind. And so whenever they stress, control your sugars, make sure you're controlling it, there is a reason. And when they do all the laser, all the injections and all of that, although it's managing it, but you're still, losing all these different portions of your life, all these countless follow-ups you have to go, and then all these procedures, which are expensive, and with insurance coverage and all of that. And so the goal always is, not to even get to diabetes. And if we get there, to manage it so that we do not progress, because the more we progress and get to proliferative diabetic retinopathy, where now surgery is needed, lifestyle, it greatly diminishes and greatly affects your lifestyle. So that, in a nutshell, is what we do when someone comes in with diabetes.
Wow. Viewers, when we are talking about diabetes, which is preventable, please, if you're listening to Dr. Wekwan with all these things that she's talking, I'm just blown away with everything happening in the back of the eye, because we don't see it. So you might think nothing is going on, and then there is damage. So please, whatever we are talking about here, let's do it to avoid these. So Dr. Wekwan, what would you say to viewers? Are there some foods that we could eat that could help us to prevent this condition? Because we don't want to get to that point. I think that is too much.
That's true. And so whenever, again, when your primary care diagnosis with diabetes, and they say, okay, now manage your intake of carbohydrates, manage your intake of oils, cholesterol, I should say, manage your intake of sugars. It's not, because I remember this is a story. Once a patient of mine some years ago came in, and we had discussed, I was monitoring him and seeing him every 3 months because his bleeding everywhere in the eye. And so I sat him down like, what is going on? Why can't we get a grip on this? And he's like, doc, it's the food. It's the food. I can't.
So good.
And it's like, it's the food. And so it's the food, as much as he was saying, it is the food. And so we have to, moderation is key. And then, Ezra Wellness does an incredible job with teaching us what we need to do, what we need to eat, when we need to eat it, to maintain health. Cut down on your processed sugars, on your processed foods, limiting what time of day you're eating said foods, the sugary drinks, soda. I mean, Coke, malt, because as Africans love malt. And if you ever should look at how many grams of sugar is in malt, even yogurt, you will be surprised.
Yeah.
Chobani, which we think is healthy, has 20 grams of sugar. It's insane.
Yeah.
And so being conscious, looking at the labels, actually being a steward, I should say, of your health, looking at the labels, how much of this is in this? How much am I consuming? And all of that really goes a very long way, because aside all the medications and all the treatment, what we always say when it comes to diabetes is your food, lifestyle changes, because that goes a very, very long way. So healthy foods for the eyes, again, aside all the caloric restrictions, making sure you're not eating too much rice, too much flour, all the processed foods also. And the misconception is carrots, as much as carrots are great because it has beta carotene, it's not the only thing that is good for the eyes. It's actually very low on the list. Spinach, kale, collard greens, those green leafy vegetables are excellent. Also, omega-3 fatty acids. So salmon is excellent. Flaxseed, very good. And then also, again, controlling what you're eating. Carrot, you can throw it in there, but anything that is high antioxidant. So you look at it, it has a dark, rich color. Very good. I know beets, it's not so popular, when it comes to our diet, but it's also very, very good and very healthy for us in general, for our eyes, but also for the whole body as well.
Good. Wow. Well, viewers, today, is there any lifestyle changes apart from the food? Is there anything else that we could do to kind of help with our eye health?
Well, always diet and exercise. That's very good. And you would say, what does exercise have to do with my eyes? Okay. But just as we've discussed, a healthy body also will reflect in a healthy eye. If you're hypertensive, it will reflect in your eyes. If you're diabetic, it will reflect in your eyes. And there are some genetic conditions also that reflect in the eyes. And so an overall generally healthy body will also translate to an overall healthy eye. And so exercising is very good for the eye and also for the whole body. So not just diet alone, but keeping a healthy, an active lifestyle. Walking, running if you're able to, but not being so sedentary, so that you keep your body in good health. Even mentally also, an active body also reflects a healthy mental state of mind.
Okay. No, Dr. Rekwa, this has been amazing. Oh my God, I've learned so much today about that.
I know.
Because when we hear diabetes, they go blind. You don't know what goes on in there, but these are things, viewers, we can prevent it. That is the beauty about this. Diabetes, it could be prevented, especially the type 2. It's called lifestyle disease. Please, let's take a look at it. Follow these tips that we are learning so that we don't get to this place. Dr. Rekwa, where could people find you? If somebody say, oh boy, now there is a change in my vision.
All right. So for anyone in Connecticut, I practice private practice in West Hartford. The practice is called Eyes on Park. We do manage, all of these conditions that I have described. And so if anyone would like to be a patient of mine, we are located in West Hartford, Connecticut. The practice is called Eyes on Park. Yes.
Great. Eyes on Park. I've been there a couple of times,
Yes.
So what I'm saying is that viewers, check it out. Even if, those of us from Ghana who cannot speak our language, English properly, thank God our own. You speak what you understand so that you got to.
I know, exactly.
All her information underneath the video. You could also give Ezra Wellness a call if you are wishing to reach her. And if you live out of state and you're looking to contact her, she'll be able to refer you to people out there that will be able to help you manage those conditions. Dr. Rekwa, what will be your last words as we bring our conversation to a close?
Okay, so lastly, I would say it's been a great experience, spreading the word and spreading awareness on the importance of preventing diabetes, first of all, managing it so it doesn't get to the point where it is detrimentally affecting your eyes. So my last words to everyone, get your eyes checked. Get it checked yearly. If you go to the dentist twice a year to clean your teeth, you can do once a year for your eyes, because we can all testify the eyes are more important. So get your eyes checked. If there's nothing going on, we'll tell you, okay, I'll either see you in a year or I'll see you in 2 years. But managing and maintaining eye health is paramount. So everyone, go get an eye exam.
Great last words, Dr. Rekwa. If you don't have vision, you are in the dark. So definitely eye check. Thank you. Now that reminds me, I have to get soon. Thank you so much for coming to Ezra Wellness.
Thank you.
Pleasure having you. Viewers, let me know in the comments. You want her to come back? Because I think there are more topics that she can educate us about. Thank you so much for your time.
Thank you.
All right, viewers, until we see you again on the next episode, this is Ezra Wellness, where you learn proven ways to healthy living. Thank you for your time.